A year of COVID, how it shaped Ohio, and what's to come. Joining us on Columbus on the Record this week, Herb Asher, OSU political scientist, Mike Gonidakis, Republican strategist, and Jackie Borcher, Ohio bureau chief for the USA Today network. You know, it's hard to mark the exact start of the COVID pandemic in Ohio, when life really started to change. Officials identified the first official case on March 9th of last year, but certainly there were cases in Ohio before then. The shutdowns really began with the closure of the Arnold Festival on March 3rd, then other mass gatherings and the closing of schools. This was Governor DeWine's news conference exactly 1 year ago today, as he and his health director tried to flatten the curve, remember.
Slowing it down will enable our healthcare providers, our hospitals, our doctors to be able to stay up with the medical problems that this virus is causing, as well as to stay up with people's normal heart problems and any other problems that they might have. We do not want to be in a situation where our medical providers are making life and death decisions of who lives and who dies.
As we can see, we're in a crisis situation now. We're moving quickly. Taking decisive action now will greatly slow down this disease and stop this trajectory. Our chief estimates at this time from modeling say that this might peak in late April to mid-May.
The good news, doctors never had to make those decisions. The bad news, the peak that Dr. Acton predicted was basically a small foothill compared to what was to come in November and in December. Jackie Borcher, looking back at that image, no masks, all standing close to each other in the same room. It's amazing how life has changed just even a couple months after that, but now a year later.
Yeah, I think if you had panned out wider from that, you would have caught the back of my head. And it is interesting. It's weird to watch that now, a year later, considering how things have changed in the last year, just even in what we know about the coronavirus. And, you know, you mentioned the projections. The projections we had in the second week of March were based off of data we were getting from China, a little bit of data we were getting from Italy, some estimates of how contagious it might be and how it might spread. And a lot of those things, you know, we didn't have masks because at the time the official line was we need to preserve all the PPE for the healthcare workers. So masks weren't even part of the equation for several weeks, even you know, and that's well before the mask mandate in Ohio. So it's like watching that video is like a completely different time than the one that we live in now.
Mike Gonidakis, how do you look back at this and the projections that were there? Because we didn't know what we didn't know then. We still don't know a lot. We really don't. We'll know more. We'll learn over the next years. But we certainly know more than we did then. How do you look back a year later where we were last March?
Yeah, I give a tremendous amount of credit to the governor and to the people surrounding him as it relates to what we did in March, April, and May, because we didn't know much. Heck, I remember they told us to wear surgical gloves to the grocery store, not masks. And that's what we did when we thought we'd be safe, right? So we've come a long way since that time. As we evolved, as we learned more, and we saw what other states were doing, other governments were doing. I'm not sure Ohio kept up with other states along the way, but at the end of the day, I think a maximum number of lives were saved, and that's a good thing.
Herb Asher, when you look back at the shutdown orders, I mean, Ohio, we shut down a lot. I think most states did shut down a lot, certainly during April. But we weren't completely shut down. But how do you think we'll look back at those shutdown orders?
I think we'll look back and say we did the best we could with the information we had at the time. I think we'll also say that in a number of states, governors actually were more proactive than the national government and the president of the United States. That they took it actually more seriously, but they were also operating with incomplete information. And they were also operating in an environment where some of the resources they needed, including masks and all the stuff, wasn't available. And they were competing with other states for it. I know we'll get to that later, but that was something that made their lives much more difficult in terms of, addressing this.
Now, if you take a look at how the disease has progressed and where we have come over the past 12 months, if you look at the chart of cases, here's how the disease has progressed over the past year as measured by the cases. Early on, we thought it was bad, but the case level was what we'd now call acceptable. Also remember back early there was a test shortage, so this may not have been an accurate portrayal of the number of cases early on. The cases bumped up after the 4th of July, that third little orange bar. Then they started shooting up rapidly as people moved indoors, got together for the holidays. Our peak, we hope it's the peak, came in mid-December, and now we are heading down in the right direction. And Jackie Borchard, it's funny, we look at how far we were locked down, how small those numbers were back in the spring and where we are now. And now we think we're almost in the clear. The vaccines help, of course.
Yeah, we're rapidly moving through vaccine distribution now. And up until December, we didn't have any vaccine in the equation. And that was one reason why Ohio and other states shut down in those early days, is because we didn't have a way to prevent it. We have the flu that's around, but we have flu vaccines and we have some herd immunity there. But we also didn't know how to treat it. So when you looked at cases, but if you look at deaths, for example, when we saw that surge of cases and hospitalizations in November and December, it was not good as far as the death toll, but it would have been worse had that surge occurred back in March and April when physicians were not as familiar with the disease and how to treat it.
Mike Konidakis, Governor DeWine was out front. He was one of the early adopters of stay-at-home orders. He was the first one to cancel a major event, I think, in the country. There might have been one in Texas that prompted him to shut down the Arnold. He was praised as being out front, even though he's a Republican governor, doesn't like a lot of government intervention. He likes the free market, stresses personal responsibility. If he had it to do over again, do you think, Mike, he would have shut down like he did? Would he have kept the shutdown in place longer? Would he have shut down more things?
Hindsight's 20/20, but I think at the end of the day, the Mike DeWine I know, the Governor DeWine I know, I don't think he would do anything different. He might not have reversed his mask mandate as he did originally. But at the end of the day, I think Mike DeWine looks in the mirror and says, I'm doing the best I can, and let the chips fall where they may. I think that's his opinion, and we're going to get into the battle with another branch of government here in a moment. But I think Mike stands by the decision he makes based on science, and we can debate it, and we can disagree with certain aspects of it, but I think he believes that Ohio is on the right course. The good news is, at the end of the day, the surge in cases, or whatever we want to phrase it, isn't a correlation to exact deaths. So that's a good thing. I'm not here to argue on that, but I think where a lot of Ohioans struggle is just because we had a high case count, we don't today, but when we did, we weren't seeing mass deaths again, which is a good thing. So a lot of things to unwind here someday when we look back at this.
Yeah, Herb Asher, it came down to, the argument came down to government mandate versus personal responsibility. And where is the line? At what point do you allow the public to take care of themselves when one person who doesn't do the right thing can infect a lot of people?
Yeah. And we see that issue coming up in a lot of other situations, including vaccinations at university campuses, measles vaccinations in parts of New York City. And the question becomes, how serious is the issue? If we found out that today there were a new strain of the virus that was lethal, we probably would say, oh my goodness, we need the national government and the state governments to really exercise strong authority. As things are getting somewhat improved now, we're seeing the ongoing resistance to mandates growing, and more people ignoring mask wearing and things like that. So this is an ongoing problem, but the challenge here is that we never portrayed this as a national emergency. In fact, it was left to the states to really handle it. Yeah. And that's okay up to a point, but there were certain things that should have been done, including assuring that we had all the necessary equipment and masks and things like that. That should have been a national government priority, led by the administration and the great deal maker that was in the White House. Instead, states were competing with each other and actually competing with FEMA. So I think there were things that, if we look back today, the one thing we could have done that probably would have resulted in fewer deaths is simply a more serious mask mandate. And if not a mandate, then simply saying, we may not have a mandate in this state, but I, the governor, and all the public health officials recommend that you wear a mask. So it's not it's going to be punished if you don't. And I think we look back, that's one of the single most thing we could have done that would have been most helpful.
Yeah, Mike DeWine was a proponent of wearing masks from the get-go, and he actually had a mask mandate for very briefly. It lasted about 24 hours, then he pulled it back. But I talked to many businesses who said the mask mandate was the best thing for them because they didn't have to be the bad guy. They could say, it's not me, the governor mandated the mask, here's the mask. So let's get to some of the politics now. Even with the end of the pandemic in sight, we hope, the legislature wants to curtail the governor's powers to issue emergency orders like the ones he's imposed this year. The latest bill would put limits on the ability of the governor and local boards of health to issue and keep health orders in place. DeWine says the legislature is not considering fully scenarios yet to come.
When the unknown becomes the known, when the hypothetical becomes real, the local health departments and the governor have to have the ability to move very quickly to save lives. So this is not about me. This is about the future and saving of lives. And it would be absolutely irresponsible for me to do anything but veto this bill.
If the legislature overrides his veto, which is a real possibility, DeWine promises to fight the law in court as an unconstitutional violation of the separation of powers. Mike Ganadakis, who should be in charge during a pandemic?
Our state government should be in charge, Mike. I respectfully disagree with Governor DeWine in his position on this. Again, a friend of mine, friends can disagree. Nowhere in the legislation that was passed with super majorities, mind you, that says he can't act quickly. Of course he can act quickly. What they're saying is after you act, after you implement whatever the tactics and strategies are to help people for the issue of the day, we want to have a little bit of a window where our co-equal branch of government. I brought a copy of the Pocket Constitution here, $1.99, Amazon.com, where we have co-equal branches of government that have equal say in our lives and how we run our country, our state, I should say, excuse me. So the legislation that's passed doesn't limit the governor from doing anything on a Tuesday, Wednesday, or Thursday. It just says after 60 days, we need to take a look at it, or after 30 days, or whatever that time limit is. So they could rubber stamp it and say, keep going. As the legislature did that in March of 2020, every single member, both Democrat and Republican, stood with the governor in March, April, May, June, July. The support started peeling off this past summer, but this new legislation that's passed, which will be overridden if he vetoes it, of course, the votes are there. It just says, hey, you do what you have to do as the leader of our state, but at some point, the legislature wants to be engaged and work with you on that. They're not prohibiting him from doing, or a future governor from doing anything.
Jackie Borchert, what is the governor's concern after the 30 days when the legislature would become involved? Is he afraid that politics and people who aren't listening to science, perhaps listening here, because lawmakers, state reps and state senators, they listen to small sections of the state and they don't represent people as a whole. And when you're talking about a public health crisis, there are a different set of circumstances that an executive can deal better with than the legislature. Is that basically what the governor is saying?
Yeah, and I think I don't have the bill in front of me, and it changed quite a bit this week. But I think the last version does allow agency issued orders, and that's a broad category. It's not just the Ohio Department of Health, it's any agency, to be repealed on the same day that they're issued. So they took a bill that the governor already didn't like, and they, took it to an 11. They also prohibited local health officials, which in Ohio, we have 113 local health departments, and they are able to enact all sorts of health orders and restrictions and mitigation measures beyond what the state sets. And they basically, in this bill, are pulling that back a little bit more and saying, well, you can't close schools, you can't close businesses, and some of these other things. So it's broader reaching than it originated, which the governor already didn't like. And earlier this week in his news conference, he, presented a couple really good scenarios or Ebola, really good real world scenarios, like Ebola, or what happened in Ohio, where back in January of 2020, we had some college students that had returned from China and possibly we thought might have had the coronavirus. We thought at one point they were going to be the first cases confirmed in Ohio, and they ended up not being. But having that power to quarantine while you're awaiting for test results to come back is something that could be, we've already known, is something that the state might want to do for diseases that we haven't even thought of yet.
Herb Asher, you've studied the legislature for a long time. You understand where the legislature is coming from, especially if the order's been in place for months. They don't feel like they have a say. They're hearing from their constituents. What is the balance between an emergency order issued by the chief executive, which is obviously valid, and bringing in the other branch, the legislative branch of government?
Well, if Mike Gonadakis' description were correct, then what the legislature is doing is somewhat benign. But if Jackie's is correct, then in fact it's much more worrisome. And I would be very worried from the point of view of local authorities and county authorities, because sometimes outbreaks happen very localized, whether it's a campus or it's a nursing home or whatever, and you do not want to undermine the ability of local authorities to move quickly. Mike, I think, Thompson, you said earlier, there's some people in the legislature for whom this is an ideological issue. It's not really about the virus per se. It's really about government. It's about they're mad at Governor DeWine, and so I think that it's not exactly motivated by the best public health concerns. It's more a little bit of a power struggle, but I do think there'll be, as Jackie was saying, scenarios in which in fact you would want people at the state level or in fact the county level to be able to move quickly without worrying that they're going to be overturned immediately by the legislature and be subject to attack. Because remember, for a lot of people, this is an imposition. And so if somebody is saying, you don't need to do this, this is wrong, it makes it more difficult to get voluntary agreement to wear a mask and things like that.
Mike, if the latest version has this immediate repeal, now granted the legislature doesn't always work that quickly, but in theory it could. That's not a good thing to have the legislature immediately overturn an emergency order, correct?
That's correct. And if an order is passed at 5 o'clock or 7:30 at night, how is on a Monday night, big state, Mike, everyone to drive in immediately to do it. So it's not practical. One thing I want to stress, though, is
But if it's in the law, though, it could happen.
It could, if it's in the law.
Yeah.
Yes, you're right, if it is. But the most important thing I think the legislation does, it does limit the 113 boards of health. I mean, when we hit 50 per 100,000 and Mike DeWine says all health orders are done, what would stop the Franklin County executive director of the Board of Health, who's not even a doctor, from saying, we're going to keep all these orders. We're going to close the schools again because we're worried. And there's nothing we can do. I didn't vote for that person. I voted for the governor and the legislature. That's why we need to keep decisions of this magnitude, our livelihoods, our ability for our kids to learn at the state level with our governor and our legislature. And if there is a health outbreak, that's why we have the Ohio Department of Health and other emergency response systems to help. But it shouldn't be left in the hands of the local yokels.
Jackie, what is there any talk of a solution or a compromise? What is the solution here? It seems like it's all or nothing. The governor has the power, or the legislature has the power. Is there a solution in the works? Has there been talk of a logical Solomon-esque solution at the State House to this?
I don't know where you go on a compromise on this. If you remember back at the end of last session in December, there was a different bill, Senate Bill 311, which DeWine vetoed, but did not come back for an override vote. And part of that was some behind the scenes compromise between the governor and the legislative leaders on other legislation. And, we're early in a new session. We've got a lot of new lawmakers that weren't part of the equation last time. We have a bill that is much stronger than it was last session. So I don't know where there's compromise. Publicly, the governor has not indicated where he would move on this bill. I don't see a way, though, that he gets out of this without some sort of additional legislative authority on the health order power. I think there's this extremely strong desire from the House and the Senate to at least put some sort of legislative check on especially health orders, but also emergency declaration powers.
Yeah. Let's get to our last topic. The pandemic has spotlighted and widened the cracks in our system. Our billion-dollar hospitals had to ask construction crews to donate N95 surgical masks to protect doctors and nurses early on. Health inequities between rich and poor, between white people and people of color, appeared in COVID death rates. Students in rural and low-income urban districts struggled with slow or no internet connections as they tried to learn from home. And as we see in almost every downturn, our unemployment system needs major work. Herb Asher, first to the healthcare system. What do you think is the main deficiency this pandemic showed?
Well, it did show here that disparate populations are more susceptible to health emergencies like the COVID vaccine, the COVID virus. I think it also showed here that as a public health system, we weren't ready for this. And this goes back to, Mike, the point you made about equipment and masks and everything. And so the whole supply chain was flawed. The supply chain was really dependent oftentimes on international manufacturers. So that's something we have to address for the next situation that happens.
Mike
Then we
Anadakis,
also have to address I'm sorry, Mike.
Mike Anadakis, do you see more health equipment being manufactured in this country now and staying here, despite the added cost, labor costs, things like that these companies will incur?
Well, unless the federal government induces a private company to build it here, if it's less expensive to do it in Mexico, Canada, or wherever, they're going to do that. But keep in mind, when the pandemic hit, President Trump did order, I think through the National Defense Act, countless number of ventilators built here in the country and distributed. We had so many, we actually gave them to China and other countries. So we were quick on our response. Yes, Professor Asher is 100% right. We were depleted. We weren't ready, but we had a quick response to get ready. We had companies here in Ohio change their manufacturing plans to build various PPE. So we're Americans. We can do this. I think we need to do better. Don't get me wrong. But the good news is we stepped up when we needed each other.
Jackie Borchert, moving to education, we saw the disparities again. Folks who had the means, they could hire tutors, they had nice internet connections in their home, multiple rooms in their home. They survived, they missed school, they missed their classmates, but folks in rural areas, lower income areas, they didn't have those luxuries.
Yeah, I think for years we will be seeing the effects of the pandemic, especially in education and in our children and how it has affected them. I mean, and a scale of things, not just their academic life and their school life, but psychologically, what has this done to some children, especially young children, where this is kind of their first or realest memory is being, staying at home and not being able to hug grandma and missing their friends, like you said, and some of that interaction. But the schooling is an immediate issue that needs attention. School districts are already trying to plan for how to catch kids up over the summer, and also planning for how to return to buildings in the fall. That's still a big question mark for many school districts, especially Columbus and these larger urban districts that have busing issues and building issues. How do they get everybody back in the building full time while maintaining safety protocols?
Mike Anadakis, real quick, unemployment system is never fully funded. The legislature never funds it because when times are good, they don't want to raise taxes. But is it time to look at having a minimum base in the unemployment fund, whether that means higher taxes or cutting benefits?
A couple things on that, Mike. Great question. Number one, we've had to borrow billions and billions and billions of dollars from the federal government just to meet some minimum standards since this outbreak hit, the pandemic hit back in March. So we owe a lot of money back to the federal government, number one. And yes, we're going to have to find a way to fund it. But I think we got to pay it back first to the feds. They're going to want their money with interest. And then we need to find a way to fund it. But we need to find a way to fix it. I mean, how many of us have found out that someone has stolen our identity and filed an unemployment claim and already? So it's a broken system. It's a hot mess, and it's a bad look for our state government.
Herb Asher, higher ed, is Zoom here to stay? 30 seconds, Zoom classes?
I think everybody at all levels of education is saying we need to get back to in-classroom instruction. And I think that's a growing consensus. I think it's especially important for younger kids, but college kids themselves, they want to be back on campus. They want to be back in the classroom.
All right.
Zoom has its uses.
Let's get to our off-the-record parting shots. This week, we have asked our panelists for one key takeaway from this past year, and we will start with Mike Anadakis.
I think it's the fact that we've come together. We might not see it on Twitter and Facebook, but I think as a state overall, in the communities across the state in various 88 counties, we've come together to help one another, and especially the kids. I've seen so many parents go out of their way to help other parents that had to work. Some houses turned into classrooms in my neighborhood alone. So I think that's one of the most remarkable things I've seen, is people coming together of all different stripes.
All right, Herb Asher.
We're now going to be very creative in trying to get back to a new normal. The Greater Columbus Arts Council is going to try to figure out ways to do public outdoor arts events. I'm pushing for a mini arts festival that features our local artists who have really taken an economic hit.
All right, and Jackie Borchard.
I would love to go to a local artist festival. I'm going to be biased and say the importance of the press and in getting information and good information out. When you can get information from all different sources, the local journalists in Ohio have been working really hard for the last year to help readers with their unemployment claims and to get information about vaccine clinics out. So hopefully that will stick around for a long time.
Yeah, absolutely. And my thanks here. Our crew here at Columbus on the Record has really come together over the past year to bring this show to you every week. It's not been easy, but we've managed it, so thanks to them. Also, I got a green tie. Jackie had the green sweater on. Let's hope next St. Patrick's Day we can raise a stout together and celebrate without masks in crowded Irish pubs. That'll do it for Columbus on the Record for this week. Check us out online, Facebook, Twitter, and WOSU.org. I'm Mike Thompson. For our panel, for our guest, have a good week.